And because we're working with patients 30, 60 days, we know that aftercare is a really important part for our patients that we work with. If we can't quite have some of that resolution that could take place in a residential setting, what do you think would be important for aftercare?
I think what my experience has been, maybe it's different because you guys are doing a great job here. It's one of the reasons I wanted to align myself with you guys after touring the facility and talking to everybody, is that the majority of clients will not go to outpatient therapy. In my experience, is because 80% of what out there is just mediocre at best and not good. So people are like, well, once I get a treatment, why am I going to go to that? And so when people, when you work experientially, you create every session some level of experience for clients, and that really hooks them. And then they're much more motivated to go to aftercare because something's really happening. Like some of my favorite comments I get from clients are, I don't quite know what we're doing, but I know I'm changing. So I think that is the hook that really will get people to stay longer and go more aftercare, because no matter what you offer, right, if their mentality is like, well, there's no value there for me because I've been to treatment, because recidivism is so high, right, for a lot of different reasons, and then they've been to so many programs where the aftercare is like sitting in a group of 30 people after work, just talking about stuff they've talked about in treatment the whole time.
What do you think is of what you taught today, what do you think is the easiest thing a treatment center can train their clinicians in that is cost effective, training time-wise? What do you think is the easiest modality to start?
I think the most rapid shift you can get is with ADP, the Accelerated Experiential Dynamic Psychotherapy. Like I said, I've done some trainings with people, and I can get them, up and running, doing some of this in an hour, or doing like a couple-hour seminar on it, where it gives the therapist a lot more confidence. I wish somebody would have showed me this so I haven't figured it out, and then I found ADP once I figured some things out. But, then it really frees clinicians from a lot of this pressure and teaches them some basic skills of how to work more experientially. And every single time I'm teaching that stuff, therapists are coming back like, oh my gosh, they're just like, the sessions I'm having are amazing, and you can get people up and running like quickly in that model, there's a complexity that you keep going in it, but basics you can really help people get going on right away.
Great. We see here in South Florida that a big push is for medically assisted treatment, and I'm just curious as to what your take is on that piece versus what you lectured on today, benefits, anything that you would add that we see down here with modality.
I'm a very open-minded person, and I think you have to look at each case individually in all forms of how you're treating them. I'm not opposed to it in some cases, but I think what I've seen a lot the last few years, it tends to be something the insurance companies are pushing, 2-week stabilization, get them on meds, and I don't think that's a solution for people. My experience working with people, they still have to end up detoxing off that. There's a difference between a 25 to 35-year-old person who has been abusing substances for a few years and somebody who's been like a 25 chronic year opioid user. This is somebody that has, maybe their relapse history is so significant, so they've never maintained any level of sobriety. This would be somebody maybe who's more of a candidate for something like that. And people are dying left and right. One part of me says, okay, I'd rather see them do that than die, right? But then I think the majority of people, it's not. They can be worked with psychotherapeutically, they can be balanced out neurochemically through holistic approaches. They don't need to be on more meds. It's so, in my opinion, it's so over-medicated. There is a neurological, neurochemical piece to this for sure, but I think you can address that in ways that doesn't just perpetuate more addiction. But at the same time, I wouldn't eliminate people that, even though it's a small percentage in my opinion, that I would eliminate that for them.
Great, thank you.